in for other coronaviruses through some predict project and others. But with this pandemic, we started testing from 28th of March, where we received the first RNA extract from Noguchi. So usually when we get a sample and the sample comes in here, we have our team, the team of doctors and technicians who work together to do the sorting. Sorting usually means that we compare the sample ID with the sample container to do matching. Each container comes with this document. Okay. So they have to make sure that every container is having a document attached to it. That is what. So this document has the name of the individual. Okay. That we don't want to show because of so confidentiality. That's the issues. Name of the individual and where the sample is coming with a specific sample ID. Okay. So this will accompany the sample sent by Noguchi to our facility here at VSD. Okay. And when it comes here, our team, as you can see from there, are doing the sorting. So you can focus on them and see they are doing the sorting. So they sort the sample up to know that the number of samples tallies with the paperwork that comes with it. We have the samples coming in the container. They have already pulled the sample and we spray around it. Okay, so this is the pooling that we've been hearing about? This is the pooling sample. So these are 10 samples pulled together. So we'll do the extraction of this RNA. So this is a pool sample that we've been hearing about. So we have this sample, we have added everything in and pulled this sample together as one sample. Okay. So when we run this sample and it becomes positive, now we have to go back to identify the individual sample to know which individual is positive among this pool sample. That is all the pool we are talking about. So this is what you have as a container? Yes. And then you put it in... Yeah, so we put this one into an Eppendorf tube. Okay. You can see from there, they have collected a sample into an Eppendorf tube or cryovials and give it a special ID. So as you can see, they are adding normal saline to the tubes and collect the sample in a pool into one small vial called Eppendorf tube or cryovials. And that sample will be sent to the BSL-3 laboratory for the RNA.
Right. Prof, help us understand better.
Yes.
What is this, polling all about?
Yeah, I think it's a very good question and it's good for people to understand it. Let me explain it simply this way. You see, when you have a pandemic like COVID-19 and everybody is concerned and it is spreading and you don't know where it is and you are testing for it, okay, you would want to quickly identify people who are infected so that you can feed the data into the analysis that the epidemiologists, the statisticians, what Bright is bringing out so clearly, you see. Now, you look at your testing capacity, and this is very good I'm saying this. Earlier on, some weeks to months back, I spoke to the media. I was asked the question, what is Noguchi's testing capacity in terms of ability to, number of samples to analyze in a day? I said, it's about 1,000, 1,200, 1,500.
Excuse me, quick now, have you stopped screening for all the other programs that use the RT-PCR and dedicated everything to COVID?
We have stopped everything and dedicated everything to COVID. You see, a good question. So you see, so some people have heard that. So you said that your capacity is 1,200, 1,000, let's say 500. Now, how come now you said now your capacity is 5,000? So let me explain it. You see, in normal times, at the beginning, we were testing 10, 50, 20, our maximum is 100, But as things are changing, the University of Ghana Noguchi Memorial Institute for Medical Research, we have a mandate. And you have to understand our mandate to understand how we work. Our mandate is so clear that we should conduct You see, novel research into infectious and non-infectious diseases. Our second mandate is to build capacity. Capacity especially through training, especially training the next generation of scientists, and also training health professionals. You see, that's the second. The third mandate of Noguchi is to provide specialized diagnostics and monitoring services, surveillance, you see. So Noguchi is a biomedical research institute of global, standard, high standard. We are expected to develop new diagnostics, and we have the capacity to do that. So when we started testing COVID-19, and we take one sample and put into one, slot for RT-PCR, and then we realize that, look, we are now being confronted with the escalated, sample, testing, the enhanced testing. What does our professional competence tell us or direct us to do? Where is the innovation which still puts us in excellence without compromising? That is where we looked at the analysis of samples by pooling. By pooling, what it means is this. You take 10 samples. You take a little bit of each into only one tube. Now, into that one tube, you have a little bit of each. But the question is, if you test this tube, should only one of these be positive? Will you pick it? So we did those, analysis and standardization to ensure that using known positives, to ensure that as little as it is there, will be picked positive. Wonderful. Now then we become very happy and strong because we have realized one thing already. Science is observation, analysis, and critical, foresight and movement. That's what science is. So we were happy for one reason, that majority of samples we are testing turn out to be negative. So if we take 10 and then we test it like I've explained, and the testing will go with positive and negative controls anyway. So we'll check our positive control and negative control if they are working. And then if the sample comes out to be negative, because we've done the robust analysis and the standardization, we know that these 10 samples are negative.
Okay.
You see, we don't have to be by force always testing one at a time. No. Science and research and development and innovation, it's not like that.
And necessity is a
matter of invention. Now, do you know this thing that I've just explained, the meaning? You won't believe it. Previously, if we took 100 samples and we tested, it's 100, isn't it? Now, if we do the pools of 10 and we test 100, we have tested 1,000 people. Have you seen the difference?
Right.
So I said that our capacity was 1,200. And I'm saying again
but is it a foolproof that there is no chance of compromise if you put 10 bits of 10 samples together and you test them at a go?
Very good.
It is not possible that you may have a positive in 9 negatives that will not show up.
That is why we did the robust analysis to standardize a test. We don't just do it because we want to do it.
Okay.
We did it with clear protocol, using known positives, and because the known positives, we can even reduce the amount of viral RNA in the positive. We even reduce the amount of viral RNA, even in the positive that we are adding to the remaining 9 to make 10.
Right.
And then still take portions of even the one that has been reduced. And then we found that our system could pick it.
All right.
So if you can pick it, what is the problem? We don't have a problem. That is science. So then we moved on. So when we say we pool, that is the meaning. But let me tell you something. This pooling thing is wonderful and good for us. But we need to be extremely careful in the future. And that is why it is very important that we saw what the VSD, Noguchi, building capacity. That's our second mandate, build capacity of health professionals. You see, something can happen if we are not careful to control the spread of COVID-19 in Ghana. And the positivity rates goes up. If it goes up, to the extent that if you take, let's say, 100 samples, maybe about 30 are positive, we can't pull anymore. Because almost